Good morning. We'll give folks another few minutes to join. Welcome, folks. We're just giving people another minute and a half or so to join. Hello again. We're just giving people about another 30 seconds to join. Welcome, everyone. My name is Kathy Kilrain Del Rio. I use she, her pronouns, and I'm with Maine Equal Justice, and I'm also chair of the MaineCare Advisory Committee. We usually start off with introductions, and that's what the agenda says. However, it did just dawn on me as we were waiting for folks to join that it might make sense to actually take one of the agenda items out of order before we do introductions, and just touch base about MAC membership, because there have been some changes to the MAC membership, and I was going to use the new list, but then I also realized a lot of people were off last week, so maybe not everybody has heard about the changes. So I think, Eric, you were going to talk about the MAC membership.
Yeah. I am pulling up in the chat the let's make sure I have this. Okay, I do. I'm putting the MaineCare the advisory page from the OMS website in the chat. On it is the new MAC member list. Letters went out to all MAC members. We essentially maintained the current list of MAC membership, aside from the individual providers. And letters went out to the new crop of MAC members for the next 3-year term, which is going to start January 1 that we just passed, of 2023 through December 31st of 2025. And I also reached out individually to the individual providers who have been serving on the MAC to thank some of those folks are here on the call, for your support and service over the last several years. And also wanted to reiterate the point that the aim of removing individual providers from the MAC is not to eliminate individual providers' opportunities to participate in the MAC and provide feedback to MaineCare, but to figure out some different structures and to maybe create a provider subcommittee. So if you look on the website that I just popped into the chat and look at the MAC member list, you will see our current working document of the MaineCare Advisory Committee's members. This is going to be tweaked a little bit. I've already received some responses from folks that have included some alternates to list. Your letter that you received said if you want to name an alternate who can participate in the event that you can't make a meeting, you can do that. Some folks have done that. And so this will likely change. And also, as you may recall, last month we had Dr. Sue Sheff here to consider a clinician role. Dr. Sheff decided that she could not make the time commitment. So we are going to continue our efforts to recruit for clinicians. Yeah, I think, Kathy, you're right to kind of pull this out of order a little bit. And maybe if we want to do the roll call based on the new list, is that what you're thinking?
Yeah.
But maybe before that, any questions or concerns about that, and anyone here who was expecting a letter and didn't get one, or didn't receive my email if you're an individual provider and didn't get the notice that this is the direction we're moving.
There's a question about defining a clinician, like when we're talking about looking for a clinician, what does that mean?
Yeah, I believe it's doctor is really what they.
You happen to have, there's federal language on this?
Yeah, it'll take me a second to pull up. But yes, I can get right to that.
I don't think it is as strict as physician, but give us a second. This is a federal requirement.
Actually, it is as strict. Board certified. Well, you're right. Committee membership. Committee must include board certified physicians and other representatives from health professions who are familiar with medical needs of low-income populations and groups, and with resources available and required for their care. So board certified physicians is a requirement that we are not currently meeting.
Mark?
And on the list, we have 2 clinician representatives. So I think at least one of those needs to be a physician, but there is flexibility for the other position.
Mark?
Yeah, thanks, Kathy. Last meeting, we talked about the possibility of a provider subcommittee, and consistent with other subcommittees of the MAC, to be able to kind of formalize provider input. I do know that we have the associations that are members of the MAC, but just wanted to see if that was still current thinking, and if so, what structure that might take. And then the second one is just to also confirm that continue to be public. If we want to show up, we can continue to show up for the MAC meetings. I just want to clarify that too.
Yeah, so the meetings continue to be public meetings, so anyone can join. And I have had my way of chairing the meeting is that if people are here, they can participate. The only time where there's like a restriction is if there's a vote, which we don't actually have a lot of votes for things, but so I still intend to do that. And then in terms of the conversation about the subcommittee, we are going to talk more about that a little later in the meeting, but that is still the plan. Any other questions?
Ying, oh, Rachel, go ahead.
Sorry, it took me a minute. I'm out of Zoom world being on vacation. I forgot how to use my reactions. Do we have a plan for how we're going to recruit MaineCare members? I'm just wondering, like this group, I think there are a lot of us who have a familiarity with MaineCare members or consumers or clients that we work with. Like, because I think I think we can all agree that MaineCare member voice has really been lacking in these meetings, and I'm wondering how we're going to actively recruit people and then retain people. So
excellent question, Rachel. But before we go there, I just want to wrap up the clinician conversation, and then we can talk a little bit on the member side. So I see in the chat, Jillian was mentioning, I think she was referring to Fran Jensen. Fran Jensen is no longer the medical director for MaineCare. We are actually seeking a new medical director, and should today actually have a job posting to share. So we'll also put a plug out that if you know somebody who may be interested in being medical director for MaineCare, please share that. Having said that, we don't want to meet and I don't even know if we can meet the requirements with our own team, essentially. So we're really seeking clinicians from the broader community. And along similar lines, maybe it's okay from a federal perspective, but we don't want to have people having to wear too many hats as members of the MAC. And so even if someone who's representing a different member organization or group happens to be a clinician, like ideally, I think we'd have a more independent perspective on that. But we can talk more about that aspect. And Norma, it looks like you may have a, is your comment or question related to the clinician requirement?
Yes.
Go ahead, thanks.
So I was just wondering if, in addition to the board certified physician, if another clinician might be a dentist. I also do recognize that we have the MAC dental subcommittee, but that's not the same as being a member of the MAC.
That's a great point, Norma, and I do want to flag that we recognized the shortfall of our previous appointments and not having a dental representative, and we have rectified that. If you look at the list, Becca Matazovich has received an appointment letter. I can't recall, Becca, if I got a reply from you yet saying you accept the appointment.
I just saw it this morning, but I will accept.
But we didn't take the thinking that you just laid out, Norma, which is also a reasonable thought. But we definitely did recognize that the subcommittee being one thing, but not the same as having some dental expertise representative on the MAC, that we would move in that direction. So your first point still stands, but
yeah, I think it's awesome that we now have Children's Oral Health Network and Becca on board. That's like an advocacy group, and having a clinician would be a little bit different. But just a thought.
Appreciate that thought. That's an interesting one that I think we will mull on a little bit.
And I mean a dental clinician is what I meant.
I was picking up your drift there.
A dental doctor, because I know,
And so is that the end of the clinician conversation? Just to Rachel's point, I mean, Rachel, this is something that we've been talking about for a long time, that we need to do a better job of recruiting MAC members. So I think if you or your organization have ideas around that, please do share them. We do have someone who has accepted being a representative who's a MaineCare member, though I don't think she's on right now, but she was here last month. And but we do need to recruit someone else. So
I would also add that we're in the process of hiring a member engagement manager and who is going to be working on this among other member focused things. And it's not just creating another position on the MAC or not just recruiting another member for the MAC, but also maybe creating a structure that's a little more member friendly than the MAC, that the MAC representative could be a conduit. But you know, these spaces often have a lot of conversations that can be exclusionary. And so we recognize that as a problem, and we're working on structures to address exactly that question.
Sarah and then Vicki.
Yeah, no, I was gonna, I didn't know, I remember a MAC member being present at the last meeting. I don't know if they were a representative of a specific population of MAC members, but I wonder if outreach could be made to speaking up for us to get one of the self-advocates and somebody who utilizes the GD service system. I mean, if there are specific areas that maybe we're targeting, I think you could probably find somebody there who might be willing and available to do that. It was just a suggestion.
Thanks for that, Sarah. And I think if you have ideas about that, please feel free to share them with Eric and Michelle. If there's specific people you have in mind, or if there's ideas you have about reaching out to that population.
Yeah, I can.
Thanks. Vicki?
Yes, one of the things I'm interested in, I'm hoping other people will be interested in it as well. One of the problems with folks who come from a MaineCare background is, and I think Eric kind of alluded to this a little bit when he was talking about the membership engagement folks. Can we develop a glossary or maybe even a mentorship program to help people come in who are coming in so that they can participate fully and understand, you know, some of the terms and some of the language and the things that we need, you know, to be aware of and understand. I'd be happy to serve on any kind of a, you know, a committee that would do that.
Thanks so much for that, Vicki. And I think that'll be a good thing for us to come back to in our conversation about committees in a little bit. Michelle?
Thanks, Kathy. I just wanted to say that this is good conversation, and I think we could and should have like an entire, you know, meeting potentially dedicated to this very topic. Sarah, thank you for that suggestion. I think it's a great one to reach out to Sufu. And I will say that we have not been targeting a MaineCare member to speak for a particular population, in part because at this point, like, we have failed repeatedly at having a structure that is supportive and successful to enable a meaningful engagement, right? And so we are really excited to have Piper on board and hope that she is able to stay engaged. But in the meantime, with our hiring of a new member engagement manager, like we really want to focus on this topic and building up a more supportive structure. I think I noted in our last meeting, which feels like a really long time ago, so I could be wrong, but I think I noted that like other states that have been successful, or at least more successful at meaningful member engagement, have a committee that is really members, and that committee may have a tie-in to a broader Medicaid advisory committee to make sure that those are looped together. But that is something we're really interested in setting up at the same time. So I just wanted to add those in because it's a really important conversation. It's something we have not been successful at. It's something that we're trying to build the infrastructure to be successful at. But there is partly a question of how hard do we try to find another member representative before we have those additional supports in place to try and increase our chances having that supportive structure.
Just in recognition of trying to make this an inclusive space, maybe we want to go back to those introductions and actually checking on who the members are that are here, and
Yeah.
recognizing we can have more conversation about this.
Yep. That's what I was just going to suggest as well. So for folks who are new to this space, we usually start with introductions. And what we do is I go through the list of MAC members that I have and ask folks to introduce themselves with their name, their pronouns, and if they're here representing an organization, to share that. And then, and I see that Esther is introducing herself in the chat. So thank you, Esther. I won't ask you to speak. So that's what we're going to do now. And again, because a few folks joined late, my name is Kathy Kilrain Del Rio. I use she, her pronouns. I'm with Maine Equal Justice, and I'm also the chair of the MaineCare Advisory Committee. And I'll just go through the list. Piper Stiles, Jamie Cotnoir, Mallory Shaughnessy.
Hi all, I am here. I just off camera with some technical difficulties. But I'm Mallory Shaughnessy, she, her, hers. I represent providers with the Alliance for Addiction and Mental Health Services. And I believe I'm co-chair.
You
or
are vice chair, yeah. Thanks, Mallory.
Thanks.
Kathy Dion.
Hi, my name is Kathy Dion, the Executive Director for the Autism Society of Maine. And I also have a 28-year-old son who lives with us, who is a MaineCare member.
Becca Matasovich.
Hi, everyone. Becca Matasovich with the Children's Oral Health Network of Maine.
Vicki McCarty.
Hi, I'm Vicki McCarty, and I'm the Assistant Director of the Consumer Counsel System of Maine, and all of our members are work with mental health challenges, and I'm excited that we're going to find a way to get more MaineCare members involved in this committee. Thank you.
Thanks. Rachel Collymore. I know Rachel's here. She spoke earlier, so maybe we'll come back to her. Sarah Squires.
Sarah Squires, she, her pronouns. I'm the Public Policy Director for Disability Rights Maine.
Gia Drew.
Good morning, Gia Drew, she, her pronouns, Executive Director for Equality Maine, which advocates on behalf of Maine's LGBTQ+ community.
Susan White.
Good morning, I'm Susan White. I use she, her, hers pronouns, and I'm a representative of the Home Care and Hospice Alliance of Maine.
Catherine Hamilton.
I'm Kathy Hamilton. I'm President and CEO of the Home Medical Equipment and Services Association of New England. And as mentioned in a previous meeting, I'm also guardian of a MaineCare member.
Leo Delicata.
Morning, Leo Delicata. I work with legal services for the elderly, and my pronouns are he, him.
Sarah Lewis.
Hello, Sarah Lewis with Maine Access Immigrant Network. My pronouns she, her, hers.
Laura Cortez.
Good morning and Happy New Year, Laura Cordes, she, hers, the Executive Director with the Maine Association for Community Service Providers, MACSP.
Rachel Dyer.
Hi, I'm Rachel Dyer, and I work for the Maine Developmental Disabilities Council. It's she, her. And I'm also happy to hear the conversation about engaging people. It's really and talking about how to provide constructive supports for meaningful participation. Thanks.
Thank you. David Winslow.
Good morning, David Winslow with the Maine Hospital Association.
Dan Moran, sorry.
Hi, thanks, Kathy. Dan Moran, Director of Communications and Government Affairs for the Maine Medical Association. Thank you.
Beth Pierce.
Beth Pierce, she, her for pronouns, and I am the Oral Health Program Manager with the Maine Primary Care Association, representing the FQHCs.
Candy Henderly. Teresa Cochran. And I'll come back to Rachel Collmore.
Good morning, Rachel Collmore, Consumers for Affordable Healthcare.
Thank you. And then normally what we do next is have MaineCare folks introduce themselves, and then we'll come back for guests. So Michelle, I'll pass it over to you.
Great. Thanks, Kathy, and good morning and Happy New Year, everyone. My name is Michelle Probert. I use she, her pronouns, and I am the MaineCare director. And I will pass it to Eric.
My name's Eric Isley. My pronouns are he, him, and his, and I am the Director of Communications and Planning for MaineCare. I do want to flag that this will be my last MAC meeting, as I've decided I will be moving on. So just wanted to raise that little flag since I've been having conversations with a lot of the MAC membership. And I will pass on to Mandy.
Good morning. Amanda Lee. I use she, her pronouns, and I am the rate setting coordinator for MaineCare. And I will pass to Jenny.
Thanks, Mandy. Hi, I am Jenny Patterson. I am the Director of Policy for the Office of MaineCare Services. I use she, her pronouns, and we have for my team today joining us Tia Baldick, who can introduce herself in her new role.
Good morning. My name is Tia Baldick. I am the EPSDT coordinator at the Office of MaineCare Services, and I use she and her. Not sure who else is on.
I can go next, Tia.
Molly? Okay.
Hi, everyone. Good morning. Good morning, Molly Slotsnik, Chief Operating Officer for MaineCare, she, her, hers. And did Lisa go yet?
Hi, good morning. Lisa Weaver with the Office of MaineCare Services, and I use the pronouns she, her, hers. And I believe that wraps up the group for MaineCare.
Thanks all. Are there any MAC members or alternates who I missed?
Good morning. Good morning, everybody. This is Lori Belden, she, her, hers. I'm the Executive Director of the Home Care and Hospice Alliance of Maine.
And good morning, I'm Suzanne Farley. I am the alternate for the Alliance for Addiction and Mental Health Service Providers. I'm also the Executive Director for Wellspring, providing substance use and co-occurring mental health.
And hi, I'm Kaylee Hess with the Children's Oral Health Network of Maine. I'm the alternate for Becca.
Thank you all. Michelle, I see your hand. I'm just going to give folks who are guests a chance to introduce themselves. So anyone who's here as a guest, you're welcome to either take yourself off mute and introduce yourself or put it in the chat.
Hi, everyone. I'm Bonnie Vaughn, the Executive Director for the Kennebec Valley Family Dentistry here in Augusta, and I use she and her. And we serve a large number of MaineCare children and adults.
Good morning. I'm Al Durgan from Spurwink. I use the pronouns he, him, his.
Good morning, Kate Christensen, oral health educator for Maine CDC.
Okay, Michelle.
Thanks, Kathy. As may be evident in the chat already, I just wanted to say that while Eric has not been with us for a long time, he has nonetheless made a really invaluable contribution to MaineCare, and so I want to thank him for that. And he has also contributed to helping define what we really want his position to be as well. It used to be more of a, I guess I'll say, traditional director of communications position. When Sarah Grant left, we rethought the position and wanted it to focus more on internal as well as external strategic planning, as well as engagement. And Eric has helped push us even more in that direction in his tenure with us. And so I will continue my recruitment efforts today. We were able Friday to post what is now called the Director of Strategic Planning and Communications. on Friday. And so I put that link in the chat. We decided to use the term communications still, in part because having someone who does have the expertise in written communications and being able to respond to those needs is really important. But I will say that under the word communications, we really are focused on engagement, stakeholder engagement, provider, as well as member engagement as being a really critical role for this position. So thanks for your help in sharing that around.
Thank you. And that seems like a good transition to other MaineCare updates, Michelle.
Thank you. And also taking feedback from last month, I did not go through our e-messages for the last month to give those updates, and encourage everybody to sign up for those e-messages on your own so you can read about our messages real time. And as a reminder, it has been about a year now, I think, that we have e-messages that are a bit more refined and targeted than they used to be. It used to be that if you signed up for a MaineCare listserv, you got every single message, and probably a lot of them you may not have been terribly interested in. And so that is no longer the case. We are limited to the number of listservs that we can have. And so there still is some consolidation, and systems wise, if you sign up for more than one list, you do get more than one message if it goes to more than one list. So that is unfortunate, but nonetheless, it's a much better system than it used to be. And highly recommend that folks sign up for those e-messages, because that's really where we communicate kind of the meat and potatoes of like what is going on with MaineCare. All right, so I think really the number one update that is not related to the rate updates that we'll be giving later in the agenda is that you may have heard President Biden on Friday signed an omnibus budget bill. That might not be the official name of it. And that bill has very serious implications for Medicaid. We have talked at pretty much every meeting about the public health emergency and the continuous coverage requirements that have gone along with that public health emergency. And those two things are now decoupled. And so over and over again, we've talked about how we did not know when the PHE ended. We would receive 60 days notice, and that once the PHE did end, then states would have 1 year to conduct redeterminations for all members receiving Medicaid. The new, the omnibus bill, when I say it decouples the public health emergency from continuous coverage, what I mean is that now, as of April 1, continuous coverage requirements will end, and that requirement for states to conduct redeterminations for all enrolled Medicaid members will start as of April 1st. So we will have a year to conduct all of those redeterminations, and for members who are no longer eligible or who do not respond, potentially because they did not may not receive information if we do not have their updated contact information, they will lose their coverage. And they may be able to get it back once they get in touch. If they're no longer eligible, then we are closely coordinating with our sister office, the Office of the Health Insurance Marketplace, also known as coverme.gov. But we now have certainty. So before it was always, we're not sure yet, we don't know, it's hard to communicate. Now we know that starting on April 1st, the continuous coverage requirement will end. So in the near term, we were talking as a department this morning about planning, hopefully for this month, to get a stakeholder session similar to the one we did. Eric, when was that? Was it in November or no, it wasn't in November, it was September. Yeah, so the last time we did a public forum about the end of the PhD was in September. So we want to do another forum like that, except to share the updated information. And it's really going to be brass tacks at this point about like, what does this mean going forward? So I will also share that the other thing, or one of the other things that the omnibus bill did is it decoupled the public health emergency from the enhanced match that states have been receiving from the federal government for their Medicaid programs. And now what happens is that enhanced match is going to be phased out over time. I'm not going to attempt to say what that phase out looks like or what the timeline is. I found what looks like a decent summary, I can find it again, that talks about this bill changes. So I'll link to that if you want to read more about it. And I'm sure there'll be lots of more helpful summaries coming out in the near future. So being way too over optimistic with my multitasking skills here, but so here is an article that that reviews some of the Medicaid, especially continuous coverage requirements from the bill that passed. But it is very important for us, both operationally as well as financially as a department, to understand those FMAP implications. And I will also say that the ability to continue to take advantage from an increased federal match is now tied specifically to a number of requirements. Those include reporting requirements. They include in reporting on things like call center, making sure that we're meeting requirements related to eligibility systems. And then on top of that, there's also the work that MaineCare needs to do to be able to, program our system to recognize the changes in the federal match rates. So there's a lot that goes along with the state being able to take advantage of that enhanced match, but it will obviously be a high priority for all of us to be able to meet those requirements, to be able to do that. And some of those requirements also relate to states really doing their due diligence to try their best to find members where we may not have their updated contact information. So there's a lot more to come. We are really, as a department and as a country, frankly, processing these new requirements. CMS has sent out a message to say, like, we're going to be talking a lot more about this and issuing guidance. We don't have CMS guidance at this point, certainly, about these new requirements, but they are very important and impactful for all of us. So we'll be communicating a lot more about it in the coming months. My team, one more thing, sorry. So I did want to say that, so the public health emergency as a status still exists, and it is still tied to certain things. So for example, we have had flexibility from a policy perspective to be able to forego some of the requirements around noticing and when we can get effective dates where there is a connection between the changes we're making in the public health emergency and COVID-19, I should say. So at this point, my understanding is that this omnibus bill does not change that. So as long as the public health emergency is in effect, we still have those policy flexibilities that either end with the end of the PHE, whenever that will be, or in the case of the flexibilities with the Appendix K for home and community-based services, those flexibilities would end 6 months after the end of the PHE. I'll also note that our uninsured coverage related to COVID, Molly, tell me if I get this wrong, but is also tied to the public health emergency. And so we're not anticipating that anything has changed with that status either. So the good news is that we have certainty. So it's easier to start to take the steps we need to take to make sure that we minimize the number of members who will lose coverage. On the flip side, it gets a little bit more complicated in that we're now tracking a number of different contingencies. And obviously, as we have known is coming all along, it gets scary, right? When we are now facing like, all right, this is the continuous coverage requirement is going to end. We have a date and we all collectively have a lot of work to do to make sure that we minimize negative member impact. And I will say to that front that, as I think you've heard about before a bit in this meeting, as well as in the forum we did in the early fall, and we'll be talking about more when we have another stakeholder forum, hopefully in the near future. The department has been taking this seriously. We are also, even before we knew about the omnibus bill, we are bringing on a consultant to help us even more with the ending of continuous coverage requirements, including the communications and collaboration to go along with that. Manat is a consultant that is an official TA provider for CMS on these issues, and they will be working specifically with Maine starting this month. And we also have our contract with a communications firm so that we can start getting out the toolkits and materials that we've talked about to be able to more effectively communicate and more broadly communicate on this topic. Eric, would you add anything to that?
Just that clarity is so important for figuring out how to communicate what's next. We've been playing a game of we'll let you know as soon as we find out for quite some time, and this actually will be helpful for just having a clear message to get out there. So it's good news.
Michelle, do you know if there's any plans, and you probably don't know yet, but maybe this could be something for the stakeholder meeting, to think about additional staff that might be needed to help make sure that as all these changes are happening, that people are actually able to get through in the call? Q?
Sure. Thanks for that question, Kathy. And actually, we also had those had plans in the works prior to the omnibus bill on that front, and the Office for Family Independence is bringing on temporary staffing help to assist with unwinding related activities because of the concerns that you mentioned. So we've made good progress on that as a department. And I also, I know Esther was having connectivity issues, so I'm not sure what her status is. There was a question in the chat about whether we've applied for any of the 1902 E14 waivers. I'm pretty certain that that we have applied for at least one of those, but I can't even tell you actually what it was. So I don't know if Esther has any more information. Oops, she's putting in the chat now. That's the temp staff piece. Yeah. But we can certainly devote more time to this topic, including specifics on waivers in future meetings.
Thank you. And one other thing, just I'd like to flag for folks in terms of the omnibus bill is that, and Esther might be able to add more to this, but just to name that for folks who get SNAP, which is definitely a certain portion of MaineCare members also get SNAP benefits. Everybody with SNAP benefits has been getting the maximum benefit because of the public health emergency, and we've been applying for this permission to do that. And that is also going to end, though I think it's ending at the end of February. So that's going to be a big shift for a lot of folks in Maine who have been getting additional help with food. So just for those of you where that particular social determinant of health is a big part of the work you do, that might be something you want to have on your radar if you're not as familiar with SNAP.
Yeah, totally agree. The term unwinding is a horrible name, and I don't know whoever came up with it. So we do not plan on calling it unwinding in our official communications, but for better or probably worse, it has become shorthand across the country for talking about the year-long process of redeterminations.
Any other updates from MaineCare, Michelle?
I'll look to Molly or anyone else on the MaineCare team for additional updates, but that was it for me.
I do have 2 updates. Neither of these are new updates from things I've been saying for the last, I don't know, 6 months or so, but I'll just say them again. So now that we are in the new year, electronic visit verification rules and regulations are now officially in place for home health and hospice services, starting with dates of service January 1st. So we have been very closely tracking. This is relevant. Please reach out to Bruce Cosgrove as the primary provider relations specialist if you have any questions. Previously, it was Tammy Usher was the lead provider relations specialist on this topic, but she moved over to ODES at the last month. So Bruce Cosgrove has taken over on that subject. So we will be very closely monitoring over the coming weeks and couple months to see how the implementation goes forward. And then the other update, which I maybe skipped the last month or so, but was giving prior to that, is another reminder on the upcoming attending provider NPI requirement. So this is the requirement that institutional claims need to have a separate designated NPI for attending providers on them. We did bump out the final deadline to April 1st to be in alignment with the date that MaineCare is going to start enforcing. And we continue to monitor compliance every month. And there's been a lot of progress since the end of the summer. But we're still seeing some of the same provider types and provider groups that seem to be less compliant than some others, and that kind of hasn't really changed over the last few months. So in particular, PNMI's home health, Section 17 community providers, we're still seeing a lot of claims that don't have that attending provider NPI on them. Hospitals as well, although for hospitals as a percentage of claims, it's much, much smaller, and hospitals overall seem to be much more in compliance. So that is good news. And if you have any questions about that, you can please reach out to your provider relations specialist. Thank you.
Michelle?
Thanks. I have a grab back. Shocking. So I did also want to flag, we also talked last meeting about the rounding rule that went into effect on January 1. We did have a request to delay the implementation of the new rounding rule. We had not been hearing through provider relations to this point of specific systems barriers, et cetera, to being able to implement. So we have gone live. We, putting in the chat, issued an e-message this morning with frequently asked questions about the rounding rule to make sure that providers are understanding it correctly. We've heard that there's been some interpretation that is more conservative than what the rule actually is. And I do ask that if there are providers that are having barriers to implementing, please reach out to provider relations, because we want to know if there are systems issues, et cetera, so that if there are significant issues, we can respond appropriately.
Any questions for Michelle or Molly? Okay, thank you. Let's move to the next agenda item, which is subcommittees. And so this came up earlier, but for folks who are new, The MAC can have subcommittees. They need to be chaired by a MAC member, but anyone can participate in them. They don't need to be a MAC member to participate in them. And we currently have 2 subcommittees, so there have been other subcommittees in the past. One is focused on rates, and it really came together during the rate setting, rate system analysis, and then all the work that's happened around rates since then. And Laura Cortez is the chair of that subcommittee. And then there's also a dental subcommittee that came into effect before Maine passed an adult dental benefit, but then the subcommittee was tasked with helping to work with MaineCare in the development of that benefit. So those 2 committees are still in place, and I chair that subcommittee. And so last month we had talked, when Eric had shared this shift in terms of MAC membership for providers. One suggestion that came up was to have a subcommittee that is focused on provider issues, which we did have. I don't remember what we called it, but several years ago before COVID. So it seems like ages and ages ago. We did have a subcommittee that was meeting some to do that work. And then it, other things became really important, and people didn't have space for that. But the idea is that that would be a space where providers could spend more time focused on some of the questions and issues that they have. And then they can also bring things back to the MAC through that subcommittee process. And then also we had briefly mentioned the possibility of creating a member subcommittee, which we did also have once up in the past as well. But again, with COVID, like that kind of people didn't have space for it, and it hasn't reconfigured. But I know that the department is also looking at a different model when they hire this member engagement person to potentially engage members. So the potential member access subcommittee could be both MaineCare members and advocates for members, or whatever we want it to look like if we want to have that subcommittee. So I said last month that we'd create some space this month to talk more about that, because we didn't really have time last month. So wondering if folks have had further thoughts about, let's start with the provider subcommittee, and whether that's something that people would like to see put in place. And I think, Mallory, but if I'm wrong, tell me, that you might have volunteered to help chair that committee to at least get it started, but that could be wrong. I could be misremembering.
This is Valerie. That is right. I did the offer to participate or chair that if need be.
Thank you, Mallory. So I think that could move forward if people are interested in that happening. And again, it needs to be chaired by someone who's a MAC member, but anybody can be a participant. So those of you who've been really bringing up a lot of provider concerns in these spaces, that could be a space where that could happen, and then figure out, like, is it something to bring to the whole MAC? Is there another way that the subcommittee wants to try to get MaineCare to address those issues? So wondering if folks have thoughts about that.
Yeah, I think it would be a good idea to establish. I think the agenda obviously would ebb and flow, and providers could choose to participate as it is relevant to them. I think it needs to be consistent and well engaged and attended to be effective. So, and then the other part of being effective based on the agenda, having access to a MaineCare designee to be attending those meetings as needed, I think is could be really helpful of being efficient during these meetings as well. So we're not just having a meeting, coming here, reporting back, oh, let's get back to you. I'm not sure. I mean, I think it could be helpful to have somebody from MaineCare at those meetings, either ongoing, kind of standing, or as needed. But I do think it is something we should do.
Mark, if I could,
go ahead, Eric.
If I could propose an idea here, like if there was an initial meeting where provider subcommittee members kind of bulleted the top 6 issues that you're thinking of that you'd like to see MaineCare engage about. Because, you know, MaineCare is a big organization, right? And the right person for the meeting, for each individual meeting, depending on what the issue is, could be very different. And if providers could get together and then kind of give us a list of here's the things, the top 6 issues, and then we could plan to like the right people at the right time from across the organization to engage with that subcommittee. Does that make sense?
Yeah, no, that makes sense. And we know people's time is valuable and you don't want to waste an hour or so if it's not the right person in the room. So yeah, I think that could work well.
Yeah, this is Mallory. There's obviously going to be a lot of different provider groups that would be engaged depending on.
Mallory, you said depending on and then muted.
Sorry, accidentally. So there's going to be a variety of provider groups and services that would be represented. So depending on what the issues were that were arising, some are going to be sort of universal, others are going to be more specific to certain provider groups. So it would have to be, you know, providers would have to be engaged in it, and then we'd have to try to bring the MaineCare to that table, depending on what the issues are. But you know, it could be very wide ranging in its discussions.
Yeah, and we talked a little bit about this on the member side, like figuring out how to give a list of things that that MaineCare could actually ask members for their feedback on that might result in changes, because otherwise people just disengage if you just bring them into the room and say, hey, come and inform us, and then all the issues you bring up aren't things we can actually do anything about. So like if we could maybe have the first 2 meetings be like compiling that list of like what are the top priorities that providers would like to see some answers on or some responses from. That way we can we can speak to the things that we cannot change and why we cannot change them, and speak to the appropriate venues for other things. Some providers may come in and want rate changes and might need to get pointed to the the rate setting webpage or whatever. But then figure out, because I'm hoping, to me, we have a list of providers who were on the MAC list, but hopefully we could maybe get some engagement from some other providers who didn't engage on, haven't been longtime MAC engagement folks, because I'm sure there's more challenges than just what is in this, in these meetings.
Al?
Yeah, I am supportive of this plan, but this conversation reminds me of one of the reasons that I am a little bit concerned. So this is a conversation about a one-way communication process. What do the providers want to tell MaineCare? What do they want to talk about with MaineCare? I really want this to be a bilateral process. What does MaineCare want to know from the provider community? That feels like an important component that somehow is missing in this conversation. And I don't want it just to be a gathering of providers. I want it to be a gathering of providers with MaineCare being present at the table so that we can have meaningful conversation. So that's my contribution to this process. I do think that the whole idea of having a subcommittee for providers is correct. I mean, I think that's a good move on the part, and move the providers out of MAC in the sort of individual provider. That's fine with me. But it needs to be meaningful conversation, not just getting sidetracked. So
Thanks, Al. Mallory?
Hi, yes, thanks, Al, for that. And I totally agree that if we are slated as an advisory group to MaineCare, which is what the MAC is, the subcommittee should also have that role. And so it shouldn't just be, these are the issues and these are the problems that we see, but it should also be MaineCare coming to the providers saying, these are some things that we're thinking about. What are your feelings or thoughts about it, and implementation or I can't say the word, operationalization of it, is to get some early conversations before MaineCare heads down some roads that may, be problematic. So it does seem to be that it should be a place that MaineCare also comes for advice.
Yeah, I'm thinking about, Laura Cordes can maybe speak to our rate setting website. We did exactly, and Mallory, maybe you were on that meeting, where we did exactly that. We said, we're setting up a new website. It's for our rate setting process. Here's what we're thinking. Can you give some feedback? Is this helpful for you? And we definitely incorporated those changes. And I think there's some question in my mind as to where MaineCare would go for, like, when MaineCare might go to the rate setting subcommittee versus when MaineCare might go to a more general provider subcommittee in some of these issues. And I think that's where, if that subcommittee identifies its top 5 priorities, it helps us at MaineCare understand, what would we come to you to talk about? What are the things we could engage on?
Yeah, and I think like, just as a, an easy thing is like chapter 1, overall rules for MaineCare that would affect all providers would be, a major issue, changes there, like the rounding rule, things like that. But I think that there could be some kind of set things, but there would also be things that come up that apply to all providers that aren't rates. And it would be the place to go, it would seem to me.
I like that idea, Mallory. I mean, and we could even have specific agendas on specific topics so people could join different meetings.
Yeah.
That's great to advertise it in advance so that the right providers would attend those provider meetings.
So it sounds like there's energy for this subcommittee to happen. Mallory, can I put it to you to try to figure out how to schedule the first meeting?
Yeah, I could work. Eric, how long are you there? Do I work with
Well, I'm here until the 20th, although my supervisor would like me to put together some planning documents, which right now are a little far behind because there's a fair bit of work on the table still.
I believe it. Maybe we could sneak in a little planning for a provider subcommittee.
Yeah, no, Mallory, I think that would fit within the long-term planning that my boss would like me to be supporting. So yeah, I think that's worthwhile. Let's find a time to chat about that.
We can talk offline. Great, thanks.
Thank you. And I know we're at time for this issue, but just to talk a little more about the member access subcommittee. So I think this is the place where I'm a little bit stuck, because we've talked about wanting to try to reconvene that subcommittee. We've also, which previously was primarily made up of advocates, but also did include one MaineCare member who was a member of the MAC. And we could reconvene that group, or whoever wants to be a part of that now. But I know there's also this like space where MaineCare is looking to bring together members in a more intentional way going forward, but it's not happening yet. So I'm just not sure whether, like, should we bring together the member access subcommittee again? Should we wait and see what's happening with this other space? Do folks have thoughts about that? All right, I'm not hearing any strong thoughts about it.
Kathy, what is the reason for waiting and not just doing both on the timeline?
Well, we could do both. That's the other thing. I guess I'm just not sure. I guess that's why I'm asking the question.
Yeah, Kathy, I'm thinking that it might be a good idea to convene the member subcommittee as soon as possible, especially since there are, the public health emergency related things are going to be an issue and a concern, and we probably ought to start talking about that sooner rather than later.
That's good thinking. The person who used to chair that subcommittee is no longer with us. So I'm willing to bring us together for the first meeting. I don't know that I can take on being the chair of it like ongoing, but maybe at that first meeting, if others have thoughts about being a chair, we can figure that out.
Kathy.
Yeah.
Sorry. So I think it's a good idea. And Leo, I was thinking the same thing, that I am interested for like a longer term member access focus. I think it does make sense for us to have our member engagement coordinator on board and kind of like have everything be thoughtful and not duplicative, et cetera. But in the meantime, because of the PHE, it might actually make sense to have a continuous coverage ending, like specific focus. But for that, I think it may also make sense. There are community-based organizations that will have specific roles in assisting with the ending of the continuous coverage, including potentially more lead roles. And we're coordinating both with the CDC's Office of Population Health Equity as well as Office of Health Insurance Marketplace on that work. And so it might make sense to see, like, can we have a group that is both things rather than us having a separate MAC, meeting that has a lot of the same people, but not exactly the same as these other structures that are being set up and meeting. Eric.
I was going to add, and we have, two of the organizations are represented on the MAC. Maine Access Immigrant Network is funded to do outreach for MaineCare around the PHE. And Cake is going to be a partner out of the Office of Health Insurance Marketplace, keeping folks informed on partnering with our community-based organizations. So I mean, it does seem like there's a natural partnership with our existing membership, MAC membership.
So just to make sure that I'm clear, so Michelle, are you saying that you think, should I go ahead and bring together this subcommittee and you could let me know who those other partners who aren't already a part of the MAC are, or should it feels like time sensitive is the only thing I'm worried about.
Yeah, no, I know. And like I said, this is happening for all of us kind of all at once with the omnibus, et cetera. But I think it would make sense for us to be able to connect with Cover Me and Office of Population Health to say, like, what are we setting up, and does it make sense to have like a single group versus multiple groups? And the answer might be no, we still want to have our own MAC, but it feels like it should be part of a larger conversation before we charge ahead with our own ideas.
That makes sense to me. So do you want to have you or someone from MaineCare follow up with me after you've had a chance to have that conversation?
I think that makes sense if that works for you, Kathy.
Yeah, that works for me. Thank you. Beth?
I just wanted to add in, and the other thing that I do at the Primary Care Association is the outreach and enrollment work. So I'm regularly in touch with all these sisters at the federally qualified health centers and collaborate with OHIM and Cake and all of that as well. So that's another pathway that communication gets sent out. So I will be obviously providing our leadership notes on today's meeting and making sure that we disseminate that as quickly as possible to the sisters, since there are so many at the FQHCs.
Thanks, Beth. Okay, so let's so I'll follow up with, once I've heard from Michelle or whoever at MaineCare, I'll follow up with those of you who might be interested in the member access subcommittee. I think I know who everybody is, but if you're afraid I might not know you're interested, please send me a message. So the next thing is actually, so I did put some thought after our last meeting there. So just for folks who weren't here, At the last meeting, it was suggested that maybe the MAC should do some goal setting to think about like what the MAC would like to focus on going forward for some period of time. But we didn't talk about like what that process might look like. So I did put some thought into what that could look like. And to be honest, I did not come up with a clear, I have ideas, but I didn't come up with a clear process because I wanted more input. So I think what I wanted to propose today is I'd love for a small group of folks from the MAC to be willing to meet with me. I know people are so inundated with meetings and legislative session is starting, but if folks could take, I think it probably would just take one meeting, maybe two, to just think through like what that process might look like, so I can hear some other folks' thoughts and bounce ideas off of people. And then we could bring a proposal back to the full MAC. So that's what I'm proposing, is that we bring together a small group to come up with an actual proposal around the goal setting process. So what I'd like to ask is if anybody is interested, well, I'll give you a chance to tell me if you have feedback about that suggestion, but also if anyone's willing and interested in being a part of that conversation, if you could let me know, then I can pull us together and try to do it quickly so that we have time before, especially for folks who are involved with the legislative session. I know it can quickly spin out of control, so we'll try to get it done quickly. And does anybody have any questions or different thoughts about that? I'm already getting a couple of people in the chat saying they're interested. So if you can just send me a message, that would be great. And it can be anybody. You can be a provider, you could be any MAC members. And if you're someone who's been really engaged in the MAC, and maybe now you're not an official member, but you have thoughts about the goal setting process, like I think it would be fine for you to join that meeting too, if you want to do that. So just let me know. Okay, so thank you all. So let's move on to our next agenda item, which is the rate system updates. And Michelle and Amanda, I pass it to you.
Thanks, Kathy. I will go through some higher level updates and then we'll look to Mandy to go section by section on where we are with Chapter 639 activities. So first, to circle back for a moment to discussion about the omnibus bill. As an FYI, if you're not aware, the omnibus bill also included some changes to the MaineCare rates that had already been posted. As I know that this affects for us rates under Section 90 as well as ambulance services. Specific to ambulance services, I'll just share that prior to the omnibus bill being signed on Friday, for example, MaineCare had super rural ambulance rates that were supposed to be going away. And there were also decreases to rates for a number of other services. So we had properly put the wheels in motion to for the rates where we benchmark a percentage of MaineCare, we had put the wheels in motion to benchmark those new, in some cases, lower rates. And we did that a couple of weeks ago to be live for January 1. And the omnibus bill is reversing some of those decreases. So we will be likely sending a communication specifically about the MaineCare changes. Providers will be made whole back to January 1. It's just we need to undo what we proactively and in a timely manner did, given action by Congress and the president. So, there's a little bump there, but it's good news overall from the MaineCare perspective. On the theme of annual adjustments, as folks, I can't remember if we talked about this at our last meeting, but again, if you receive e-messages, we did send out an e-message about the January 1 cost of living increases, including adjustments as required under Part Quadruple A relating to making sure that rates stay adequate to cover the 125% of minimum wage for essential workers. Those, I will say that we are waiting on one confirmation specific to T2016 for agency home supports, that the work that needs to happen with EIS is still on track. But otherwise, and we are hoping also for T2016, those adjustments should be live. The T2016 should be live by the end of the week when billing should happen, but I'm just confirming that last piece. So those are in system as intended and communicated previously. And Laura, I can circle back once. I'm hoping that today I'll see that email that says, yes, we are still on track. We're just trying to cross that T, but I have no reason to believe that we're not on track, but just wanted to double check. All right, so those are all regular updates. As everyone is aware, we had a number of rates where there have been rate studies in progress. I am happy to confirm that as we have intended, we will be securing January 1 effective dates for all of those rates. And the sections include section 2, 13, 17, 26, 28, 65, and 92. So there will be 1/1 effective dates for all of those services. In order to secure the 1/1 effective date, we needed to do noticing for state plan amendment. We achieved that noticing on Friday for all of those sections except for section 2. We, for a while, have recognized that with our later start to section 2, which is adult family care homes, we would need to utilize a disaster state plan amendment in order to secure that 1/1 effective date, but that is still our plan with section 2. So all of those services will have a 1/1 effective date. I will say that the services that represent new services that were part of the rate study process, those will not be effective January 1. So January 1 was intended to update rates. As an example, there is still ongoing work around mobile crisis, where we're changing what those service requirements are and what it looks like. And those mobile crisis changes are not ready to go into effect for the service, and therefore the rates are not going into effect on 1/1 either. So there's a small number of services where that applies, but the 1/1 changes are really for existing services. So on Friday, consistent theme of today is that you should have received an e-message if you're signed up about those effective dates. The notice, the e-message linked to the SPA notice that shows the rates, where the rates are changing. We communicated in Friday's message very conservative estimates of when rates would be going live, or basically we said I don't remember the precise wording, but at the latest by these X dates. I will say that we today or tomorrow will be sending out another e-message to let folks know what I will tell you now, which is that our aim by the end of this week is to have a more detailed e-message where we will, on a section and service level, provide specific instruction for billing and implementation dates. So again, our aim is to send that out by the end of this week. For this week, we would ask that providers not bill so that we can get out that additional detail. And some of that additional detail is necessary because there are instances where we are changing modifiers or where we are changing units of service, and we need to make sure that there is proper understanding and education about what those changes are before providers start billing. So the ask which I recognize is not exactly the same as when it went out on Friday, but is really, please don't bill this week. And we aim to have an e-message that provides greater detail by the end of this week. We are very optimistic that there will be minimal impact, if any, due to having to hold claims. And so we just needed to be able to do the due diligence of systems testing, as well as conversations with all the relevant MaineCare units. And, you know, last week, for some reason, not everybody was working. So we really needed the time this week to be able to make sure we had connected with everyone, to have 100% confidence in the message that will go out by the end of, that we're aiming to put out by the end of this week to provide that additional detail. So today, we are hearing a lot, not surprisingly, about concern with the understanding that providers may have to hold claims for a much longer time period. So we're going to be issuing as soon as possible just a addendum to last Friday's message to say, please hold for this week. More information on a service specific basis will be forthcoming very soon. And then the last update that I wanted to share is just that we absolutely appreciated and took into great consideration the feedback from our stakeholder forums around the proposed, not proposed, I should say, draft rates that we shared. I think it was November, but don't hold me to that. Because of our prioritization of making sure that we could get 1/1 effective dates for these services, we do not have all the documentation of responses to comments, et cetera, ready to go live right now, because we wanted to make sure, number one, that we could finalize the rates, get them effective for 1/1, and have providers be able to start billing those. And so we are aiming to have the full documentation as required under Chapter 639 by the end of this month, where you can see where and how we took feedback into consideration for the finalization of the rates.
I see Mark's hand, but there was a question from Pete in the chat asking about current rates, specifically Section 65 HCT 15-minute billing.
Yeah, my question was related to Pete's, and I'm not sure if he needed to hop off or not, but I think I can ask the question. So I think that the question is, particularly for HCT that's going to a weekly billing model. It's currently a 15-minute fee for service model for the period of time from January 1 to whenever the new weekly payment model is implemented. What should we do? Because we don't have the minimum billing requirements for weekly rates. So we don't know exactly how to track, what to do. We're not billing. We're going to hold off on billing until we get clarification on all of it. But that was, I think, his question.
Thanks, Mark. I do not have a specific answer to that question, but I will say that this is why we're asking that providers hold billing for this week. And that's the level of detail that we want to have in the message that we would aim to get out by the end of this week, so that there is clarity at a section, and in some cases, like in this example, a service specific level with that additional detail.
Okay, great. And I just have a really quick follow-up on the some of the provisions that might change. I'm thinking of behavioral health homes specifically around, I think there was a note in that notice that said, additional reporting requirements or metrics that the department will be asking will be forthcoming, and same kind of question of knowing what those metrics are tied to the new rate. We need to make sure that we're doing our due diligence and covering all that to get the rate and the monthly payment. So similar bucket, and maybe a similar answer.
Yes, thank you for raising that, Mark. So for certain services, really those that are moving to a more flexible alternative payment model, we are going to be implementing a performance-based component of the rates. The noticing the SPA noticing that was linked in Friday's message did note that for CMS purposes, but there is a process, as has happened with other services, where there's a performance component where obviously providers need to know what are those measures, and so what are those measures, how is this going to work, all those specifics. So we basically have a placeholder to be able to have performance-based components for the rates, but we are not implementing those as of January 1 until we have that further detail and those conversations worked out.
Okay, great. Thank you. Very helpful.
Laura?
Thank you. Good morning, Michelle, and thanks for the updates and for taking the time to just clarify that there will be a do not bill notice for folks, because I'm getting a lot of questions about that this morning myself. And I wondered at this point if you knew, and I know we'll see something at the end of the week, but and I can imagine it's going to vary by a section and service, but do you know the largest period in which you will be asking folks to not bill? Will it be, could it be 6 weeks that you're asking folks to not bill in some cases, if you're looking at mid-February?
So I don't want to make commitments this morning, and this is what we want to get out by the end of this week. I will just say again that we're feeling optimistic that we'll be able to implement this in a manner that should not be a hardship to providers. But I don't want to speak for others in terms of specific services at this point.
Thank you.
Any other questions? Laura, do you have any updates from the subcommittee?
I will share for the rate subcommittee that we did not, because of holiday conflicts as we were closing in on the end of the month, have a meeting in December. Our next meeting will be Monday, January 30th at 2 p.m. And, just to go back to our earlier conversation about really intentional conversation and inclusion among folks. I really do appreciate the department's engagement with the rate subcommittee, especially in that last quarter as 639 was in place. And I know that'll bode well for, the other committees that we're developing, or subcommittees of the MAC as we move forward. I think, I'll just go back to thanking the department and Michelle again for your team's work in making the quadruple A and the COLA rates in place in January, and I appreciate you flagging the T2016 rate, and it sounds like that'll get resolved quickly, but I know it's a lot of work, and I know at our last meeting from the rate subcommittee we had asked, okay, effective January 1, but is there any concern that it might be delayed? So I know there was a lot of hard work that went into getting all those rates in the system ready for billing January 1, and we really appreciate that. I encourage folks as we're continuing to shift to make sure that everybody who wants to participate in the subcommittee meetings can and has that information, that I'll look to Kathy and other folks from the department for an updated MAC member list with contact information. So if there is the chance that we have to cancel another meeting, not only will I send it out to the regular folks, but to a larger list. And then we can also talk about how to get that kind of hooked up online as well. So folks from the public that may want to come to a subcommittee meeting, whether it's ours or any other subcommittee meeting, will have a contact and regular schedule and a Zoom to come into. Thank you.
Thanks, Laura. And I apologize, Mandy, I skipped over you. It sounds like you have some additional updates.
That's okay. Yeah, I'm just gonna run through the list of rate study updates. And then if people have questions at the end. So my list is getting pretty long here, but I have for adult family care homes, there was no change from last month, really. We're still planning the public presentation of rates by January 12th. And the effective rates will still be retro to 1/1. For behavioral health, we have finalized the rates. The SPA noticing issued Friday, and the target for documentation, including the response to comments, is supposed to go out the end of the month. CCBHC certified community behavioral health clinics. That is still in the procurement process. We hope to have awards issued to the vendor at some point in January. Crisis rate changes were noticed Friday. There's no other rate changes. No other rate changes for 1/1/23. And we're still working on the responses to comments. For day health, the rates were finalized. SPA noticing issued Friday, and the target for documentation, including response to comments, is coming end of the month. Family planning, the kickoff for internal is scheduled for January 6th. That's an internal meeting. And then the public forum is scheduled for January 26th. And a notice did go out for that. F2HCs, we have providers are still submitting cost reports, cost report templates, and there's a public meeting on January 18th. Hospital acutes, no update from last month. We're still, the vendor's still working on the preliminary internal analysis. Hospital IMD services, we are still working to schedule meetings with stakeholders and the vendor. Hospital psych and substance use disorder units. There's a public forum to present draft rates and receive public comments scheduled for January 12th, and that notice will be going out very soon. Nursing home and residential care facilities, the contracting is in process. There's internal kickoff meetings on January 12th. I believe there's a possibility of having another one on the 19th, but for right now, we're planning the 12th. And then that's going to be internal. And then the kickoff meeting will be 2/1. And the initiation notice is going to be going out soon for that one. Psychiatric residential treatment facilities. We are still working internally with sister agencies to finalize the service model decisions. Section 23 is, we're still working on response to comments. There's an internal meeting January 9th. We may possibly do another public forum, but we haven't decided on that yet. And then section 60, we are working on response to comments. And I believe those are supposed to be wrapped up in the next couple of weeks. Other than that, the only other update I have, and I guess Eric already mentioned it, that the website went live. And I will put my email in the chat so that if anybody has suggestions or questions on the website, you can shoot me an email. And that's about it, unless there's other questions.
Any questions? Okay, thank you. Let's move on to the rulemaking packet. Jenny?
Great, thank you, Kathy. Since I'm going right after Mandy, I will just say the website is awesome. Please check it out. There's a lot of really useful information there. So it's exciting to me to see all of our work being just available online. So just quickly, because I know we're short on time and we've already talked about a number of issues that relate to the policy packet. Just flagging again, Dean Bugay has left OMS policy. He is no longer the Children's and Behavioral Health Policy Manager. We are hoping to fill that position soon, hoping to post it soon, but he is now an Associate Director at OCFS. We have 2 open comment periods, and those are both on waivers. And so this ties in a little bit to the discussion on the end of the PHE. As folks know, Appendix Ks expires 6 months after the PhD ends. And so we are working now in a concerted way for all of our waivers and waiver services to make sure that we can have continuity with the flexibilities in the Appendix Ks as we renew or amend our waivers. So the first 2 notices on waivers were just posted, and we do have open comment periods. One is for Section 19, home and community benefits for the elderly and adults with disabilities. The other is Section 20, home and community-based services for adults with other related conditions. The comment period is open now, and comments are due by 11:59 p.m. on January 30th. So do check out the website. I can put in the chat the link to those notices if folks want to look in more detail about the changes. And we are expecting other notices for the other waivers as well to be coming soon, because we're trying to work on all of those for July 1. Let's see. I think most other things in the packet have been touched on. Again, we will be working on rulemaking to implement many of the changes, but as Michelle said, our focus has been on getting the methodology notices posted for the rate study changes and for some of the other changes. So we continue to work hard.
Thank you, Jenny. Are there any questions? Okay, thank you. Next up is the, oops, sorry, I opened the wrong tab. Communications updates, Eric.
Yeah, there's a couple of things. I do think that Michelle buried the lead. Mandy and Shannon from our office really put together a fantastic website. Jenny just highlighted. I'm going to share it just quickly. So we worked with the rate setting subcommittee on this website. We wanted it to be user-friendly for folks. It gives a basic outline of what a rate determination is for maybe a new provider or a member of the public who has no idea about this process. Kind of lays out the basics of the steps. We're going to be putting in a flow chart that has much more detail for people who really like digging into the weeds, which, if you're involved in policy in the state of Maine, you might be. And then you can look at the current calendar rate determinations that are in process. So all the updates that Mandy's giving are, you can see them here. You can see what are coming up in the future. And you can see what ones we've finished, like dental, some of the other like big picture things. This is where they'll wind up. Again, by section of policy with all links to all of the information for each section of policy. There is a ton of information here. Mandy put her email in the chat because anytime you put a ton of information in there, if you have questions or notice any errors we're going through and trying to make sure that this is as perfect as it can be, but like this is constantly changing. So, and it has some of the, if you've used this is on the MaineCare website. If you go under the About Us, Projects and Initiatives, MaineCare Rate System Reform, you can find this website. And if you're interested at all in rate setting, this is your home. This is where you want to be spending your time. And we will be updating it and keeping it as a single source of truth for folks as we move forward. Along the stop share. Along similar lines, I just want to remind people that if you go to that same About Us and down to advisory groups, there is a MaineCare page, and that MaineCare page has the updated list of membership. Laura made a great point. If we put together kind of lists of what the subcommittee, similar list of what the subcommittee memberships are, we could absolutely post them to the website so people could see if you're in the dental subcommittee, if you're in the rate setting subcommittee, a provider subcommittee, so we could have a little bit more transparency and access and information for people. That would be really helpful. Also, just to flag, these meetings are recorded now and they are going on this website. So, you know, all of this stuff, we get into detail often, and I just want to try and pull back and flag that for everyone here as we work on talking about what our, you know, what the MAC's mission and goals and kind of key aims are. Just wanted to flag some of the reminders of what some tools are available. If the MAC were to come up with a mission statement, we could put that on the advisory on the MAC page, that kind of thing. We can use this. So I will take no more of the time of this update, but I wanted to again flag the great work that, as Laura said, Michelle's team really means folks like Shannon and Mandy doing awesome work to get the word out so that you all can see updated real time what MaineCare is doing. And even those of us who work here are appreciative of the folks at MaineCare. So yeah, that's my communications update. Any questions? Thanks so much.
Thank you, Eric. And I just want to echo others' words about appreciation for the work you've done while you've been with us. Really appreciate your thoughtful approach. So that is our agenda. We're a little ahead of schedule, so that's good. I didn't hear any specific agenda items for February, but I will say that we will revisit the subcommittee conversation to make sure everybody knows the schedule for the new provider subcommittee, and if there's been a meeting before the next meeting, that we can share updates from that. And then also we'll check in about the status of what's happening with the member access subcommittee. And then we'll also spend some time talking about the goal setting process, because that group will come together before the next meeting. Is there anything that I missed, Jenny?
Nothing that you missed, but something that I missed. I mentioned at the MAC meeting that we are working on putting together a stakeholder session on the school-related health services, and we have not yet sent out a notice about that date. The date that we are hoping to hold that session is the afternoon of January 19th. So we are hoping to send that notice out, and if there is someone who is interested and thinks that is not a viable date, please let me know. But that is what we're hoping to do. Thank you.
Thanks, Jenny. Dan?
Hey, thanks, Kathy. So this might not be a big deal, but I noticed there are a few, if not a handful of people that, including you, who are going to be boots on the ground here with the legislative session starting. And these meetings are at 10 o'clock on a Tuesday. And you know, Tuesdays and Thursdays at 10 o'clock is when the legislators normally meet. I mean, the good part is that they schedule 10 and they meet at like 4. I'm kidding, almost. But you see where I'm getting at. I don't know if these have been scheduled at 10 a.m. Tuesday all the time, but if somebody has some flexibility, you know, Mondays, Wednesdays, Fridays might be a little bit better as the legislature gets rolling, but that's just me.
I don't think that there's a perfect solution, because also committees end up meeting on Mondays and Wednesdays, especially. We have kept it at this time during legislative session in the past, and it normally works. There was one work session where both Michelle and I were caught in HHS at the same time. So Gia and Molly had to fill in for us at the last minute. But we have managed to make it work. I think it's hard to try to find a new time with so many people involved, but appreciate that concern. The good thing is these meetings are now recorded. So if you do get stuck at the legislature and want to revisit it, you can also check out the recording.
I was just trying to make things better for Leo in the new year, so sorry.
That's okay. Thank you, Dan. Any other last? I did have a question for you, Michelle, I think. you mentioned earlier that you're planning to reconvene, like to have another stakeholder meeting around the end of the continuous coverage, and that would be this month. When you send that out, last time I think we sent it to the whole MAC, so I assume you'd want us to do that again.
Yes, and I should say that, again, because this omnibus bill really happened like over the holidays and vacation weeks, there was really acknowledgement this morning that we need to, as previously planned, have a stakeholder session, and it would be good for that to be this month, but we haven't even officially started to try to schedule that yet. So I'm hoping that we can pull that off for this month. And yes, I think we would likely invite the same. We would at least invite the same folks that we invited the last time around, which would include the MAC.
Okay, thank you very much. Okay, well, I think that is everything. So we can end a little bit early today. If you have any, I'll try to grab the things that were shared, links and things, and I'll share them out a little bit later today, since so much was shared today in the chat. And I'll also share the link to the updated list of MAC members, so everybody has it in case you didn't get that earlier. Thank you all. Have a great rest of your day. Happy 2023.
Thank you.